Migraines. What frequency, intensity, and using mat or paddle. So migraines are fundamentally an inflammatory problem. So it's a headache, it's a pain, and you can, like any other pain in the body, magnetic field therapy can be useful to help with that pain, as can acupuncture, as can red light, as can many other therapies. But in terms of magnetic fields, again, the intensity is very important. So depending on the system you have, if you happen to have a biobalance system, 5 Gauss or 10 Gauss in the case of the small pad applicator, it's going to take you a lot longer to get a benefit. Clearly, it's very important with migraines to start treatment at the very beginning of the migraine. If you wait till it's really settled in, then you're going to need dynamite to get rid of it. And that's why even with the therapies that are conventional medical therapies that are available, you often have to clobber them to be able to get rid of them once they're settled in. You may have to go to the ER and get injections of painkillers and for nausea and vomiting to get rid of it. So the sooner you start, the better. That means if you have regular migraines, you better own your own system. You can't do this without having your own system because you have to have it handy right then and there to be able to treat yourself. There is research that shows that a very high intensity system that's probably about 1,000 to 2,000 Gauss applied to the back of the neck on a daily basis prevents migraines. It's approved by the FDA for that purpose. It's very expensive. And you actually don't own it when you get it, and it has to be prescribed by a doctor. And good luck finding a doctor who would know anything about it anyway. So if you do own a PEMF system, try it. Use whatever you can. I recommend the smaller applicators if you have a system that has a whole body pad and a small applicator. If you have a high intensity system like a Tesla Fit Plus or one of the Tesla Fit systems or the PowerMan's Flash, then you probably don't need to treat it as long because it's such a high intensity. It can work very, very rapidly, especially at the beginning. Again, once the migraine is really settled in, that you may need to treat for a longer period of time. And even treating the back of the brain, back of the head, you can treat on the sides of the head. If you have a single pad applicator, just put it to the side of the head. And you're going to have to experiment a bit to find out which placement works best for you. You're going to have to also experiment and have some experience over time, which intensity works best for you. Usually I recommend going low and slow. So if you just got a magnetic system and you are getting migraines or you have migraines, and if you're using it and you're using it at the highest intensities already, then your body probably can tolerate it. Again, at the highest intensity, when the migraine is the worst, that's when you're probably going to be the least likely to tolerate the highest intensity. You may find that to be true. If not, that's fine. But what I would do is I would start off with lower intensities, build up to see whether you could tolerate the high intensities at the peak of the migraine. But at the earliest onset of the migraine, when the nervous system is not as irritable, because with really severe migraines, light, sound, all of these can make the migraine much worse. And so what you want to do again is when you're that sensitive with the migraine, that you want to start lower, and you might need shorter periods of treatment time before you can tolerate higher intensities and higher treatment times or longer treatment times. So you're going to have to figure that out for yourself. Unfortunately, there's no hard and fast rule. Everything is very individual. Every person's different, and their reasons for having migraines are different. So again, trial and error, experiment. And I certainly do, if you do have regular migraines, I really do honestly recommend that you consider getting a PEMF system, because that's going to make your life a lot less uncomfortable. And if you're using the magnetic therapy on a regular basis, like that FDA approved device shows, using it preventively, so if you use it every single day, then you can prevent the onset of the migraine. If you have menstrual migraines, you may want to start treating a day or two before the period begins, because then you're going to affect the chemistry of the period, the cycle, but you're also going to sort of stabilize the nervous system and make it less irritable, and again, probably decrease the inflammation in the brain that's activating the migraine in the first place. And that irritation and inflammation in the brain, or the blood vessels of the brain, sets you up for sensitivity to hormonal fluctuations. So again, pre-treatment, regular treatment probably will help to decrease that risk for you.